Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome to another episode of this mini-series about sexual well-being. I started this series on Valentine's Day of 2025, and I want to continue talking about sexual wellness because it's not something that's talked about very often, and a lot of women are completely misinformed about many conditions that affect them. In this specific episode, I'd like to focus on a couple of conditions, Vulvodynia and vaginismus, which affect women regardless of their age. So I think that this series is providing me with a great opportunity to provide some education around the process of intimacy, and especially why it can be so painful for so many women. Because I might be presenting solutions you might not know exist or you might have not heard of before. Women talk to women, and they talk about intimate things. Men don't, but women do. So if someone confesses to you that they're going through this, and you have heard my podcast episode, you might actually provide a solution for them and give them some very useful information. Many women suffer from painful conditions that limit them or do not allow them to be intimate comfortably. And unfortunately, many of them suffer in silence. Now, obviously, this is not helped by the fact that most doctors and most OBGYNs are not really prepared or interested in addressing such issues. They don't really promptly or effectively have conversations with women about these. So after a few failed appointments, women simply give up. Again, I want this podcast episode and the ones before it and the ones that are following in this series to be educational to the point that women that are identifying as having the conditions that I highlight in these episodes will understand that there's significant help out there and that there is a solution to their problem. Obviously, before I get into the nitty-gritty of the kind of help and solution that's available, I will repeat one more time, it is important to know that the help and the solution is very different depending on the circumstances and the medical conditions that are at the root cause of the situation that's causing painful intimacy. So again, this episode, it's all about painful intimacy afflicting women both before and after menopause. I have already addressed painful sex due to loss of estrogen and specifically due to menopause that hits us after 50. This episode is about everything else that hits us and causes painful sex, and it will be continued next week. So let me talk about the first condition that afflicts women, and it's one of the most commonly undiagnosed conditions that is creating painful sex, and that is vulvodynia. So this medical condition has at its root problem, at its cause, a disturbance of the nerve endings in the woman's delicate intimate tissues. Basically, the skin at the entrance of the vagina feels like it's on fire. It burns and hurts with touch. Sometimes that happens even when a woman sits down, wears tight panties, tight pants, or tries to ride a bicycle or do other activities. It can be a very disabling and a quality of life altering medical condition. Obviously, it's simple and easy to diagnose by gently touching the skin of the intimate opening with a Q-tip. This way, the doctor can map out the most sensitive areas. The evaluating physician will write down numbers along the opening on the right and the left side of the vaginal opening, top to bottom. These numbers would signify the degree of discomfort from 0 to 10. 0, no discomfort. 10, obviously very severe. Then both the doctor and the patient can track it over time, see how it responds to treatment. What is the conventional medicine treatment for this condition? Immunomodulators, medications like gabapentin, or tricyclic antidepressants like amitriptyline. They can be taken orally, and they both work really well, and they have improved many women's lives significantly. Amitriptyline is probably more effective than gabapentin and probably less side effects. There are also topical compounded creams that can be applied to the vaginal skin. Those contain various combinations of gabapentin, amitriptyline, which again are these immunomodulating medications that dampen the excessive response of pain that happens instead of touch or pressure. And sometimes the immunomodulating medicine is combined with lidocaine to provide the much needed numbing that's required for a woman to use either during the day if she's going to sit down for a long period of time, or maybe right before she's going to be intimate, allowing the intimacy to go forward without pain, as well as possibly using low to medium dose steroids or maybe other anti-inflammatory agents like baclofen. So there's a couple of very valid conventional medicine approaches. There is no FDA-approved vaginal cream for vulvodynia, so any topical cream will have to be compounded by a compounding pharmacy in a cooperation with a physician that's comfortable prescribing these medications, and sometimes starting with a low dose and maybe one of them and then adding a second and then adding a third, rather than just throwing everything at it in one cream one time. Obviously, this type of medication does nothing to cure the condition. It just has to be applied on a regular basis to immunomodulate and dampen this neurosensitivity. To cure the condition, we need to understand what caused it, and we simply do not know. Most likely, there is some type of immune system dysregulation that occurs specifically in this area, creating this hypersensitivity to touch. Again, what that means is that every single touch point or stimulus, whether it's gentle or stronger, instead of sensing touch or pressure, it simply hurts and creates pain rather than the gentle pressure or pleasure as it's supposed to. Now, what else is out there for vulvodynia that you might have not heard of? Laser therapy, you might be saying. Wow, really? Laser for vagina? Who came up with this? Well, the South American nations like Brazil, Colombia, and European nations like Italy have been leaders in this technology. They are not impeded by the FDA regulations and restrictions when new technology to improve women's health is discovered and developed. So the other nations lead the way, not the US. The majority of studies, and there are many out there, are international studies. Very few are done in the US. And that's for a specific reason. I'll talk more about it if I decide to do an episode about lasers for vaginal health, which is already kind of taking shape in my mind, and stay tuned for that. Coming back to the technology for the laser, once this type of technology is introduced in the US, you will only get it in the private doctor's office. No community or corporation-managed clinic system will invest hundreds of thousands of dollars in something that could restore women's intimacy and well-being that is not billable and reimbursable. This will be a huge financial gamble. Whether you can raise enough revenue to cover costs and how soon that will happen, it means marketing and lots of education and lots of time spent informing clients of the technology and why the cost for it. And it means perhaps choosing to help women's lives without the certainty that the revenue from the laser will pay off. Now, I was pitched Mona Lisa Touch Laser in 2015. That's 10 years ago. It was my first laser, and I loved the technology, how simple it was, and how effective at improving women's health and lives with no need for hormones, especially as some women cannot use hormones, or they choose to use patches and creams that are not always very effective at providing steady levels of hormones, which I explained are needed, much needed, to restore their intimacy garden to its blossoming grandeur from their youth. Mona Lisa Touch has been the first laser therapy introduced in the US for vaginal health. It has been 10 years, and now there is a plethora of laser platforms and technologies in the US that are applied and used for women's intimacy needs and various problems, offering valuable and effective solutions in many cases where conventional medicine fails to provide any kind of relief. Again, I will dig deeper into this subject maybe, but let me get back to the conditions I was talking about, specifically vulvodynia. Many women have no idea that the application of energy to the vaginal opening skin tissues can actually rewire the nerve endings and act as a very powerful immunomodulating factor. In other words, it can help whatever is causing the dysfunction simply reset the nerve endings, dysfunctional firing of impulses for pain. It can just stop that. It can help heal the tissues and the nerve endings using the body's own healing mechanism that's stimulated by the laser. Laser energy, whether it is smooth mode, erbium, YAG, CO2, even possible gentle microneedling, could provide long-term relief. You usually need a series of monthly sessions. We're talking about 3 to 5. And it's likely to provide 6, 12, maybe 18 months, possibly longer, of significant relief. There are studies to show that laser applications to the skin affected by vulvodynia helps alleviate the pain, allowing women afflicted by this condition to be intimate and lead a normal life. If you want to know more about this, all you have to do is schedule a consultation with me by clicking the link from my website at the bottom of the podcast episode and request an appointment. I would be more than happy to wow you in person and have the honor to change your life. I would be remiss to say that the conventional medicine approach to this can also be to give you an antidepressant. Again, this has been featured in one of the episodes of Sex and the City, if you've ever watched that series, where I believe Samantha says that her vagina is depressed and she has to take an antidepressant. It doesn't really work, but it's something that conventional medicine and conventional medicine doctors might recommend. Now, personally, I believe the reasons why many women still suffer from vulvodynia is, number one, the primary cause is not treated early and effectively enough. And number two, many women make the mistake of giving up prematurely on seeking the right and correct treatment. Sometimes there is no right and correct treatment. You have to try the treatment that will work for you. Sometimes women give up due to the lack of funds, which makes sense because compounded medicine, hormone therapies, lasers, PRP shots, etc. are not covered by insurance. And all of these treatments that could help are likely completely cash and out of pocket. So there needs to be a significant investment of time and expenses in reversing this condition if it doesn't respond easily to conventional medicine, to compounded therapies, or to other functional medicine, holistic medicine interventions like food sensitivity testing, elimination diets, autoimmune diet, etc. Let me go on and finish this episode with another big reason for painful intimacy. Let me talk about vaginismus. Vaginismus affects many women, young and aging women, young and older. This is not talked about very much, and many women, when I tell them that this is what you have, they have never heard of it. When they come to see me and I discuss the diagnosis, though they have been to other doctors, which is mind-boggling. What is vaginismus? Vaginismus means that the pelvic floor muscles located right at the opening of the vagina suffer involuntary contractions, narrowing the vaginal canal and making intimacy impossible or extremely painful. It simply feels like a significant obstacle right at the entrance. Once it's overcome and the penis has been able to get in some cases, some women are able to relax and enjoy the rest of the intimacy act. But for some women, relaxation is impossible because this is an involuntary contraction and it just creates this huge barrier to intimacy, and intimacy is not possible. Most likely for many women who suffer from vaginismus, it starts out with some form of a psychological, emotional trauma or fear related to the act of intimacy with a man. And it gets worse and worse to the point that the spasms of the muscles guarding the vaginal opening are so strong that allowing intercourse and being intimate is no longer possible. Painful sex is probably the top one factor leading to vaginismus. If a woman keeps having pain during intercourse for whatever reason, and this pain during intercourse is not addressed early on, and this pain could be caused by vulvodynia, endometriosis, fibroid uterus, all kinds of things. If this cause for the pain is not addressed early on, it's very possible that a woman who keeps enduring the pain and putting up with it instead of seeking care and treatment will likely end up associating intimacy with her partner with pain. And she will expect pain, anticipate pain. Therefore, subconsciously, the involuntary muscular contraction will happen, whether she wants it to happen or not. This is a defense mechanism meant to keep the partner out. It becomes a very effective barrier, which again can be extremely difficult to overcome if not addressed early. This can also happen for women at menopause that are suffering from atrophy due to loss of estrogen. They keep putting up with it. They keep using lubricants. Eventually, lubricants fail to help them. They don't seek help, or they've sought help and they've been turned down and told, I'm sorry, there's nothing we can do. Or they're being given a little tiny vaginal insert that's twice a week that's not doing much to help them. Or maybe it helps them for the beginning and then it gets worse again. And they keep putting up with it to the point where they, again, associate pain with intercourse. So the vaginismus, this involuntary muscular contraction, becomes inevitable. Please, if you're listening to me, talking in your ear on this podcast episode, do not be that woman. If there's any painful sex or in the future, if painful sex becomes an issue, please address it early. Now, for vaginismus, pelvic floor therapy is extremely effective. Behavioral therapy, relaxation techniques are very effective to address vaginismus. But first and foremost, the cause that led to the vaginismus, which might have disappeared and resolved by itself, maybe was a bad endometriosis flare-up, for example. But most of the times, the cause is still lingering in the background, and it will have to be resolved. So again, pelvic floor therapy is highly useful, works really well in treating this condition, but it is possible that certain energy delivery systems like photobiomodulation, shockwave therapy, or electrical muscle stimulation could possibly help rehabilitate the muscles of the pelvic floor, as well as help improve sexual well-being. How do we diagnose vaginismus? Well, it's very easily diagnosed during a pelvic exam. And any experienced gynecologist should be able to have a very honest and frank conversation about this condition. Now, I believe the reasons why many women still suffer from this condition is, number one, the primary cause is not treated early and effectively. So I'm going to repeat this again. The primary cause is not treated early and effectively. Number two, many women make the mistake of giving up prematurely. Sometimes they give up due to lack of funds, which makes sense because physical therapy is subject to deductible and can become expensive and time-consuming as you need time away from work or college, and it has its cost. And many women are too busy to be compliant with the very much needed and absolutely required homework, okay? Number three, many women give up because they fail to understand that it takes stamina and endurance, mentally, emotionally, and physically, to put up with all the treatments that are required to reverse the condition. You don't go to the gym for 3 months and then you never go to the gym again. Rehabilitating the pelvic floor muscles when a woman has vaginismus, it's not a 3 months treatment. And we don't have a magic pill. Unfortunately, 3 months is what the medical insurance might cover you for. But it could take much longer than 3 months. The woman might have to use vaginal dilators at home 2 to 3 times a week for a long time and will definitely need to continue to work diligently with both her pelvic floor therapist and her gynecologist until the condition is absolutely 100% resolved. Again, many women do not understand the commitment, the fact that they need to continue the therapy long term. Sometimes it could take 6 months to a year or more to reverse something that you've had for years. Giving up after a month or two because you don't see results is not the way to go, because this is not an easy fix and there is no magic pill. Now, talking about a magic pill, while we address the condition for vaginismus, a woman can continue attempting to be intimate and use medication that can help provide some form of relaxation during the act of intimacy. Benzos are a good example. Now, this is a valid treatment option. However, some of these medications that cause relaxation have side effects. The woman might not enjoy the feeling of being sedated or groggy a few hours later. Taking it, being intimate, then going to sleep might help as far as the timing, so that the effect of the medication is dissipated by the morning. But again, this is a temporary solution, not a long-term solution. So to recap, in this episode, I talked about 2 big reasons for painful intimacy in younger and older women: vulvodynia and vaginismus. Vulvodynia means sensitive vulva, where everything is perceived as pain, and vaginismus is a condition where involuntary muscular contractions happen in the anticipation of pain or for fear of pain, creating a barrier to the act of intimacy. Both these conditions have effective therapies and can be addressed easily, but there is a time and financial commitment to getting them resolved. And the women that are affected by these conditions need to know that there is help out there. So if you know of anyone that is afflicted by any of these two issues or has painful sex without knowing exactly what's causing it, please ever listen to this episode, as it might shed some light as to what's happening. In the next episode, I'd like to talk about endometriosis and painful sex. This is obviously something that affects younger women, but younger women get older. And when they get older, they need to use estrogen. And estrogen and endometriosis are not necessarily good friends. So there is a significant risk that painful sex will continue after menopause for women with endometriosis if they use estrogen therapy. So stay tuned next week about other conditions that can cause painful sex. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.